Phace syndrome refers to the association of malformations of the posterior fossa of the brain, hemangiomas, arterial anomalies, cardiac anomalies, and eye anomalies. The cause of Phace syndrome is not fully known, but it may be associated with sporadic mutations on X-linked genes and abnormal development in utero. Now, the most characteristic manifestation of Phace syndrome is segmental infantile hemangiomas, which are benign tumors presenting as soft red-blue marks typically on a child's face, scalp, or neck. These hemangiomas are typically large, measuring more than 5 centimeters. While the hemangiomas are not usually cause for concern, other anomalies associated with the syndrome can cause disability. Individuals with Phace syndrome may also have structural brain abnormalities that typically affect the posterior or back of the brain, such as cerebellar hypoplasia, which is an underdevelopment of the cerebellum, a brain structure responsible for balance and movement. This can manifest as low muscle tone or difficulty standing or walking. Next, one or more of the arteries that supply blood to the brain may narrow or be absent, decreasing blood flow and increasing the risk of stroke. These anomalies can also lead to other neurological issues, like seizures and neurodevelopmental delays. Now, the most common cardiac defect seen in Phace syndrome is coarctation of the aorta, or narrowing of the aorta, which is a large artery responsible for carrying oxygen-rich blood from the heart to the rest of the body. This narrowing can cause damage to the heart over time, as the heart must work harder to push against the narrowed vessel. Finally, eye anomalies typically affect the structures in the back of the eye, like the retina or optic nerve. The retina may have abnormalities in its blood supply, and the optic nerve may be underdeveloped, both of which may lead to vision problems. Additional eye features can include cataracts, which is clouding of the lens, and microphthalmia, or small irregularly formed eyes. Some individuals with Phace syndrome may have additional symptoms like hearing problems, feeding difficulties, sternum or breastbone deformities, and endocrine anomalies like decreased secretion of thyroid hormones and growth hormone, among others. Alright, now Phace syndrome is diagnosed through history, physical examination, and identification of characteristic signs and symptoms. Large, segmental infantile hemangiomas are an easily noticeable feature, and they're present at birth or shortly after, so they're usually the first to raise suspicion of Phace syndrome. Various tests may be done to look for other features of Phace syndrome, including an echocardiogram to look for cardiac anomalies, magnetic resonance imaging of the head, neck, or chest to look for arterial anomalies, and an ophthalmology exam to rule out any eye anomalies. Currently, there's no single treatment for Phace syndrome. Rather, each anomaly is addressed individually. Infantile hemangiomas are commonly treated with a medication called propranolol, which helps to decrease the size of the hemangioma over time. Other symptoms, such as coarctation of the aorta and other arterial anomalies, can be corrected with surgery or interventionist radiology. Alright, as a quick recap. Phace syndrome is a rare disorder characterized by structural defects of the posterior fossa of the brain, large infantile hemangiomas, arterial anomalies, cardiac anomalies, and eye anomalies. Diagnosis is clinical, and treatment involves addressing each anomaly individually.